Good afternoon and welcome everybody to the second town hall in a series of town halls focused on the Hubs and Spokes initiative at the California Department of Aging. We'll give folks just a couple more seconds. It looks like that attendee number is continuing to climb and I know everybody's getting settled in. All right, well, before we get started, a couple of logistics housekeeping items. First, participants will be muted during presentations, although we do have ample time at the end of the presentations for Q&A and comments. So we look forward to connecting with you during that time. You can use the raise hand icon on your Zoom toolbar or the Q&A icon to submit comments and questions. Closed captioning is available as well as ASL interpretation. Our ASL interpreter Kim should be on your screen. And to enable closed captioning, you'll want to hit that live transcript or closed caption icon on your toolbar and select show subtitle from the menu that pops up. The presentation and recording from today will be archived. You can find it on the California Department of Aging's YouTube channel or the Hubs and Spokes network page. It's linked in the presentation and we will try to drop it into the Q&A as well. And I will turn it over to Connie.
Thanks, Maria. Good afternoon, everyone. I'm Connie Nakano. I'm with the California Department of Aging. Thank you all for joining us today. Today is our third stakeholder engagement for our Hubs and Spokes initiative. You'll see here on this slide, we've got several stakeholder engagement opportunities that we will be hosting now through the end of the year. The next one will be September 28th, another town hall focusing on rural and remote California. October 12th will be the LA and Southern California regions. We also have an online feedback survey that you can find the link on our website. I'll show you shortly where you can find that. The survey is also available, not just in online form, but if you need a printed form, we do have a phone line which you can call and leave your information and we will send you a printed copy as well. We do have 3 webinars planned that will have some leading experts that will be leading those webinars. And also we welcome any written recommendation by email as well. Also in December, we will be hosting a results briefing that we will be working in partnership with Sacramento State University in aggregating all of the results and feedback and everything that we've heard from the town halls to the surveys to emails to comments. And just bring forward to everyone, what we've collectively heard. The deadline to submit all the feedback is October 15th. Here you'll see where you can find the information on our Hubs and Spokes webpage. If you go to the CDA homepage under highlights, you'll see that there is a link that can take you directly there. And we have a direct link as well in the presentation. We'd like to see who's joining us here today. So we've launched our first poll for the day. So if you guys can take a quick minute just to tell us, who you are, that'd be great. We want to see who's attending. So next I'll roll into our agenda. Next slide. Oh, sorry. Next steps. So what we're going to do with all of this information that we gather, again, the deadline to submit feedback is October 15th is what we are looking at. Both the California Department of Aging and the California Commission on Aging will host a results and recommendation briefing in partnership with Sac State. What these can result in is, it could possibly, everything still to be determined. It could include state bills, budget, or local actions to develop and advance recommendations. Next slide. So today's agenda, really quickly. First, we'll go through the opportunity for California to build back better. We'll run through quickly the vision of a Hubs and Spokes for aging and disability in every community. And then also we'll move into local perspectives. We'll hear from a couple local perspectives where they'll go over opportunities, challenges, and recommendations. And then we'd roll into our public discussion where we hope to have a collaborative discussion on some of the topics we brought up. So we've got some of the poll results here. You can see who's joining us today. So feel free to fill out that poll if you've still got it up, but it looks like we've got quite a few. We've got our partners with the Area Agency on Aging. We've got representatives from local city or county advocates and also service providers. So now I'll roll into, if you want to press the space bar one more time, Nancy. There we go. Building Back Better, and I'll toss it over to Marcy Adelman and Annie Chung.
So happy to be here with you. Thank you, Connie. I'm Marcy Adelman. I'm a clinical psychologist, psychotherapist, and LGBTQ longevity consultant and co-chair of the California Commission on Aging. And I'm here today with my colleague, fellow San Franciscan Commissioner Annie Chung, President and CEO of Self-Help for the Elderly, to host the Bay Area CDA's Hub and Spoke webinar. One of the top priorities this year for the Commission on Aging is to support the Aging and Disability Resource Connection. The importance of improving access to person-centered, culturally competent aging services and supports for all Californians in every county cannot be understated. The California Commission on Aging is an independent state advisory body created in state law to serve as the principal advocate for older Californians. Through the work of advocacy and advising, the Commission seeks to serve as a catalyst for change that supports and celebrates Californians as they age. Our vision is Californians can age with dignity and respect in the setting of their choice. With members appointed by the governor and both houses of the legislature, commissioners represent the racial and ethnic diversity of the state, as well as the state's cultural and geographic diversity. The CCOA's mandate to provide input to the governor, state departments, and legislature gave us a unique opportunity to be integrally involved in the development of the Master Plan for Aging, and now implementation and monitoring. The Commission specifically supports the initiatives focused on strengthening leadership at the local and state levels, including revisiting the local structure, the purpose of today's town hall meeting. To be clear, the Commission has taken no position on how the local area agencies on aging structure might be reconfigured. So we are pleased to be here today to partner with and support the department and to listen to you. Annie.
Thank you, Marcy. Annie Chung, also on the commission, and I work and live in San Francisco. So next slide, please. So as you all know, aging is definitely changing, and we're getting more and more diverse. Soon, the over 60 plus population will exceed the population 18 and under for the very first time. I think by 2030 is the projected date. Two recent nationwide polls by the SCAN Foundation and the AARP confirm that people want to continue living in their homes and communities as they age. You looked at the figure, 88% really prefer to stay and age in place. Also, today's older adults approach their retirement years differently. Many want to continue an active lifestyle, either by working or by volunteering. And many are caregivers, caring for family members or raising their grandchildren. And they provide some of the most important volunteer services in their community. Marcy?
Marcy, you're muted.
Yes, I was. Thank you. The last 2 years have been an unprecedented and historic period for older adults in California. The COVID-19 pandemic shattered norms and created urgency to address the disparities and gaps in health and human services delivery systems. Today, California has an opportunity to learn from adapting to an emergency situation, including advances in technology, acceptance of telehealth, innovative partnerships for meal delivery, housing and healthcare with long-term services and supports, virtual social contracts, expanded internet access, and now workforce configurations, new workforce configurations. The Governor's Master Plan for Aging, developed during the pandemic and released in January 2021, offers a bold vision of a California for all ages at a time when systems change is not only timely, but essential. Today, we have an extraordinary federal and state investment in home and community living services, navigation, transitions, workforce, and infrastructure. The home and community-based services spending plan alone is $3 billion. The convergence of these factors offers us a once-in-a-generation opportunity to build back better with a system that connects people to services that allows them to live with dignity and independence in the homes and communities of choice. These changes are fundamental to meeting the needs of a growing and diverse aging population. Annie and I would like to take a moment to briefly describe two relevant San Francisco programs. I'll start with first describing the Dignity Fund, which is a relatively new program administered by the Department of Disability and Aging, primarily through contracts with community-based organizations. I serve on the Dignity Fund Oversight Committee. The fund targets resources and programs for low and low middle income seniors and adults with disabilities, in particular older adults and adults with disabilities with chronic illnesses such as HIV and diabetes, and underserved communities such as the LGBTQ and the Hispanic Latinx community. The fund stabilizes funding for current aging services and provides additional set-aside dollars each year to address unmet needs and the emerging needs of San Francisco's growing diverse older adult population. DAS conducts an equity analysis and needs assessment process every 4 years to identify strengths as well as service gaps. The Dignity Fund plays an important role in helping diverse older adults and people with disabilities live and age in their homes and in their communities. Annie?
Thank you, Marcy. And as one of the service providers in the Bay Area in San Francisco, particularly in providing for a very low income minority and non-English speaking population, we're really very grateful that the city passed this Dignity Fund. I think without it, we'll still be struggling to fund some of the really necessary services. But now I'd like to talk a little bit about the ADRCs, which is the Aging and Disability Resources Centers, as well as the expanded information and referral services. So you may or may not know, but in 2016, San Francisco opened up a hub where a lot of the city services serving the veterans, the caregivers, the diverse aging population was in one place. It's like a one-stop benefits center that a lot of the diverse population in San Francisco could go and get to and apply for these much needed city services. But Kim later will talk about it in more details. But as an expansion or an extension of this hub and spokes model, San Francisco also funded probably 14 by now, these ADRCs, these Aging and Disability Resource Centers in almost every neighborhood in San Francisco. A lot of them offered language, that spoken, a lot of the different languages that are being spoken in San Francisco, like English, Chinese, Spanish, Vietnamese, Russian, and also Tagalog. And also these neighborhood ADRCs serving the particular community that usually are afraid or have more or less access to city services because of their cultural and language barriers. So these 14 ADRCs in San Francisco are geographically diverse, also language and cultural competent services. We have added 2 ADRC sites with specialized focus serving the disability community and the LGBTQ community. So a really good model. If anyone wanted more information on the San Francisco Benefits Hub or on any of our ADRC, our website on the Commission on Aging will provide those to you. As Marcy noted, we are very fortunate to have unprecedented financial resources for the aging programs. We are also fortunate to have a thoughtful master plan in aging, informed by thousands of hours of stakeholders' work and the dynamic leadership of Director Kim McCoy-Wade and her exceptional team and Secretary Gawley at the Health and Human Service Agency, all of whom are willing and waiting for your input. Thank you very much for attending our town hall today. I look forward to dynamic and informational discussion. And now I have the pleasure of introducing Ms. Kim McCoy-Wade to provide an overview of a proposed vision for our hubs and spokes for aging and disability in every community. Kim?
Thank you, Commissioner Chung and Commissioner Edelman. It is wonderful to be with you, even virtually. It's a pleasure to be with the Bay Area and Central Coast. In my mind, I am traveling from 97-degree Sacramento down to the cooler coast and seeing the Bay and the ocean with all of you. So thank you for welcoming us to this virtual town hall. I am going to briefly talk about history and vision, and then we'll go to hear from more examples of hubs and spokes in the Bay Area and Central Coast. So as Annie and Marcy outlined, the Master Plan for Aging called for leadership in aging at every level, at state and local level, in order to serve our growing and diversifying aging population. And one of those initiatives, as you may recall, there are dozens of initiatives, our homework for this and next year, was to revisit California Area Agencies on Aging, Local Leadership Structures, Initiative 101. Related was build out the No Wrong Door system statewide for public information assistance, Initiative 98. And again, recognizing it's a state and local partnership, create the governor's office leadership position on aging, disability, and Alzheimer's. So leadership matters. So in that spirit, next slide, we are proposing a vision, a framework, if you will, of hubs and spokes that came up time and time again in the Master Plan for Aging process from stakeholders and from the public. And this picture tries to capture why. Why hubs and spokes, the consumer experience. On the left side of the slide, you see a person following a maze of arrows from questions about housing, questions about home care, questions about transportation, volunteering, all kinds of services and supports that we all need to thrive as we age or experience disability, looking like a maze. And what the vision that we heard from the public, what we heard from the subcommittee on long-term services and supports, what we heard from the Alzheimer's, Governor's Alzheimer's Task Force chaired by Maria Shriver, was that we need one door to walk through where we can be greeted with people who will do a person-centered engagement with us on what we need in language, in culturally competent, and then provide us connections to connected, comprehensive, and coordinated services and supports. And so that's that picture on the right, a person at the center, a hub of a wheel of services that again are comprehensive and that are coordinated. And as you can see, the person is at the center, making sure that the services are what matter to them and match their preferences and priorities. So, okay, if that's the vision of what we want the customer experience to be like, how do we as state and local leaders deliver that? Next slide. And so that's where this framework of hubs and spokes came up. And what this proposal is can we all commit to building hubs and spokes all over the state? On this picture, you can see a network of hubs and spokes drawn over the map of California. That is just a graphic image. That is not a specific map, but you get the idea of hubs and spokes, almost like an airplane flight map. And what this would be is the state would commit to a foundation and a framework, a blueprint, if you will, for every local community to adapt and adopt. Both words are important, adapt and adopt, to deliver person-centered, equity-focused, and data-driven services and outcomes to all of us as we age. It's only a framework, and we'll talk about it here more on this next slide, because every community needs to make it their own. We heard a little bit about San Francisco, how they have done a version of this, and we'll hear shortly from Marin and Ventura County about how they are building out their hub and spoke system. But here's what we mean on the theory. What does a hub and spoke framework mean? Let's start at the bottom. At the bottom in the light green, you'll see the word foundation off to the side. The foundation of any hub and spoke is a partnership, a very close partnership between the Area Agency on Aging, county adult services, and community-based organizations working in aging and disability. AAA, county, CBO, we sometimes say. All three of those service providers are essential to allowing Californians to age in the way and place we want to. And that partnership is at the heart of any successful work to make California for all ages. Okay, but let's take it the next level. Once we have those three working together, what are the common elements of a hub and spoke system? You see that in the top half, the framework, and we've identified 6 planks, we think, of this house that we're building. Maybe you'd call it the support beams. The first on the left is one door or no wrong door. You sometimes hear the hub. Where do I call to find out what's available to me as I age in my community? Is there a web page, a phone number that can start my journey in learning about what's available to me? The second is the spokes. Once I find that door, once I walk through it, what can I find about? Is it only some services? Is it a diversity of services? Is it truly everything as I journey through aging, the different ages and stages of aging? Can I keep coming back and finding whatever else myself, my family, my caregivers might need? Third, is it just a referral, or is it more than information to truly be assistance, person-centered options counseling, care coordination, in language, all of the things that in neighborhood, as Annie talked about in San Francisco, that make that a quality experience, that make it more than just information, but truly meet you where you are. Partnerships. Aging is everything. So 3 of the key partnerships that we think are important in coming years and have been for a long time. One is with health plans. Health plans are increasingly partnering, and thanks to the California leadership at CalAIM, to fund home and community-based services. So how do we link the adults world and the health plan world? Another key partnership, and I hate to say it, emergency services. We know that fires and earthquakes are unfortunately part of life in California, and older and disabled adults can be much more at risk. How do we make sure that our adult services, our aging services, and our emergency services are prepared? And thirdly, our historic and essential partnership with tribal leaders in California. We have a large and diverse community of tribal organizations, tribal nations, where government to government respectful partnership is essential, and there's so much more to do in this area. Lastly, but essentially, we know that we need to be more data-driven and data for action. So we are already moving at the state to bring our entire network of AAAs and ourselves into one modern data reporting system that we can then show public dashboards so we can all see how we're doing together. And fiscal admin, lastly, but not at all least, we at CDA are working hard to streamline and modernize and reduce the administrative burden that sometimes has gone along with the Older Americans Act programs, moving to electronic payments, exploring reducing contracting for other more nimble but still rigorous processes, so that really the money can serve people effectively, quickly, and administrative, while important to invest in, isn't taking too much of our time and money. Okay, so that's a lot of theory, but let's hear what happens when it hits the ground in reality. Let's move to practice. So let's hear 2 more case studies from in this region. I'm delighted to hand it off to Eli Gillardin from Marin and Victoria Jump from Ventura, and then hear from all of you about your experiences, your questions about whether this vision makes sense, and how you'd improve it, and then how we can move it forward together. Thank you. Eli.
Tim, thank you so much, and thank you for your resilient leadership throughout COVID. Just honored to partner with you. Very nice to meet you all. Marin Center for Independent Living, Eli Delarden, CEO. Next slide, please. So what I'm going to give you an overview is kind of what the foundation of the hub and spoke looks like in Marin County. And if we're talking about studs or framing out, I would say that Marin's hub and spoke model is dried in. So we might have some sheetrock, maybe some electrical outlets. We're working on building a full house. So we're still very much in process. Just a little history. So back in 2014, our Aaa, Marin Aging and Adult Services, and Marin Center for Independent Living really recognized the need for coordinated services, both for older adults and for people with disabilities, recognizing this shared journey that we're all on, whether we are aging into disability or aging with disability. Just as background, Marin CIL is a 42-year-old community-based organization, independent living center, one of the earlier independent living centers established through the original disability rights movement in Berkeley. And Marin Aging and Adult Services acts as our AAA in Marin. So not only administering Older Americans Act dollars, but also coordinating several safety net programs, everything from food and nutrition and information and assistance line, our IHSS program, Adult Protective Services, Ombudsman and Veteran Services. Next slide, please. So in Marin's ADRC, we really have two what we call core partners, and that's our AAA and our Independent Living Center. But looking at the hubs and spokes and what we've expanded over the past few years, we have really seen a significant amount of extended partners. And I'm just going to mention some of those by name. So Marin Community Clinic is our federally qualified health center, and they have provided essential services for our vulnerable older adults, people with disabilities, Medi-Cal, Medicaid recipients. And in partnership, our ADRC supports Marin Community Clinic in triaging or case managing some of the highest risk members of Marin Community Clinic, ensuring that they continue to receive access to care throughout their journey and ensure that they're diverted or their risk of re-entering hospitalization or skilled nursing is minimized. We also, through the ADRC, coordinate very closely with the Ombudsman program and our skilled nursing facilities and assisted living facilities in the county. And certainly throughout COVID, in coordination with public health and other key CBOs, we've worked to do our best to reduce spread of coronavirus within our skilled nursing facilities, coordinating, outreaching around vaccination, ensuring that our individuals with access and functional needs who can't get to a clinic for a vaccination have access to mobile vaccination. This is just another example of kind of expanding that hub and spoke model. I also really want to highlight our awesome partnership with Vivalon, who is providing paratransit services in our community. In addition to paratransit services, Vivalon and our hub and spoke model have worked during disasters, including the Woodward fire in West Marin, to pre-evacuate folks within that affected area who needed accessible transportation to safely get out of the fire risk area and secure stable temporary housing and have access to their medical devices, as well as battery support through a new program of Marin CIL and to an extension, our hub and spoke model, Powered and Prepared, which provides individuals with high voltage batteries and disaster preparedness training. We work with several other community-based organizations, and I could go on, but I'm very time restricted here. So just highlighting again the core services of ADRC, enhanced information and referral, benefits planning or options counseling, short-term service coordination, and nursing or hospital to home transition support. Next slide, please. There are so many opportunities, and I'm probably not going to hit all of these, but just in some of those examples, what we're really talking about is streamlining access to services, ensuring that our community members get the support they need in the time they need it, recognizing that particularly during COVID, if an individual is having to bounce from one service provider to another, from one county program to another, from one healthcare provider to another, their risk of, exacerbating their health conditions, their social isolation, or just falling through the cracks is significantly expanded. So what we're really trying to do is expand access for everyone. Through our ADRC and our hub and spoke model, we really see the opportunity to provide more person-centered services, culturally competent, recognizing each individual has their own life experience, ensuring that they have access to the services and supports that meet their needs. And as Annie mentioned earlier, recognizing that in the lens of equity, those services are provided in a culturally competent and accessible way. And also really considering that, we are in times where data and record keeping and, outcomes really need to be, streamlined, and information needs to be shared between partners, but in a safe and secure way. So how we go about establishing streamlined systems for data, technology, data sharing is going to be essential. Next slide, please. Challenges. What we learned through our ADRC early on, our core partners and our extended partners really need to be clear about what contracts, what partnerships they're entering into, and not just at the leadership level, but at the frontline staff and service provider level. Same with policies and procedures. I mentioned confidentiality, how essential that is. We have developed agreements on how our county and our Marin CIL and other CBOs share information. I talked a little bit about data. I want to talk specifically about ensuring role clarity and warm handoffs, recognizing that we might have multiple service providers working with one individual. The key is communicating between service providers, between frontline staff, between departments or organizations, having regular case conferences, having regular in-services, even in some cases, cross-training staff between county, the services at Marin Center for Independent Living and other CBOs in our community. And we have an exciting new partnership in Marin called the Aging Action Initiative, or as we say, the Asian Disability Action Initiative, which really looks at cross-training and providing the public education on how our community providers can work together and refer each other to each other's programs. Next slide, please. So just kind of an example of some of the impact that our hub and spoke or One Door has had during COVID. We've assembled and delivered over 3,000 packages of PPE, provided over 250 caregivers to support individuals who were really at risk of losing their caregiver support and entering skilled nursing or assisted living. In partnership with an awesome countywide food distribution expansion program, delivering over 250 weekly meals, gift cards, laptops, high voltage batteries, I could go on. But really trying to meet the community at every level, particularly during COVID. There's much more work to do. We're still very much building our house, our One Door model, but we're very excited about the opportunity, both through the Master Plan on Aging, as well as what we're engaged in and have developed locally, both with our core partners at the county, as well as our extended partners, as mentioned earlier. I will answer your questions later, and just again, really appreciate the opportunity to share what we're working on with you all. And I'm gonna pass it over to my friend Victoria, who's going to talk about the Ventura County model.
Thank you, Eli, and I'm very happy to represent the Bay Area and the Central Coast and our strong network of area agencies on aging. I have included a graphic to try to explain our ecosystem in Ventura County and really how people access services. So one thing I do have to say is that we are a different model than many other area agencies on aging, and that really we are a single county department formed in 1980. So we're a standalone agency, meaning that we're not housed in social services, and I report directly to the county CEO. So as an area agency on aging, we provide many of the contracted direct services that other AAAs do. And really we are kind of a hybrid. We're also an aging and disability resource center like in Marin County, which Eli spoke about earlier. As an ADRC, we do work hand in hand with our Independent Living Resource Center, also known as ILRC. We also have an active and engaged advisory council who is involved in program development and expansion. So many of our most innovative and responsive programs are a direct result of our advisory council. We do consider ourselves a full service AAA and that we operate many of our programs directly. We do have a close collaborative relationship with Adult Services, which is a separate county sister agency called the Human Service Agency, as well as other county departments to include Housing and Homeless Services, libraries, child support, our district attorney, emergency services. We feel that our system works and that our ecosystem also includes private businesses, strong community-based organizations, collaboration with our behavioral health and healthcare system, other disability-focused service organizations such as our regional centers, and also philanthropy. Next slide, please. So we love our model because it works for Ventura County. And it really has enabled us to serve more and more people each year, but growth does come with challenges. During COVID, we were able to serve more than 5 million meals. And last year we fielded over 60,000 calls for help. This is a heavy lift, but because we have an amazing ecosystem of providers, they were able to jump in and help. So collaboratively, collectively, we made all of this happen. So some of the challenges that we see is, the big one is that we have a system that is funded to serve a much smaller population. As an ADRC and direct service provider, when day after day you hear heartbreaking stories of need, in the back of our minds, we know that the actual need is much greater, and that if everybody showed up at once who needed the service, we wouldn't have the resources to provide the service, and it would probably break the system. We also have an increasingly growing population with the complexity of the needs. The person that's coming now, for help is not the same person that came to our, door 20 years ago. It's very different. We also have a challenge that eligibility rules are often tied to age and not to need. We're seeing more and more people under the age of 60 that are in need, and we really have to be creative in how we can help. But as an ADRC, and with our partnership with our Independent Living Resource Center, it really makes it a lot easier to meet the need. As far as opportunities, we see that there are tremendous opportunities for our region and the shift towards the integration of healthcare and social services, such as the CalAIM initiative that's going on right now. And we also see there's opportunities for local and regional partnerships. With how funding comes down, a lot of times there's small amounts, and we see the potential of pooling funding and having one provider locally providing a much more robust service than if individually we were to try to do it. Next slide, please. So our recommendations, and if I were queen, what would I do? My recommendation for the state is, as you're going down this route for looking at the hubs and spokes and trying to develop, a statewide, model for how services are delivered, have a clear understanding of the system you're trying to build statewide. Really know what it is that you want to build before changes are made. The system users have to be part of that design. Our growth as an agency from where we were, 20 years ago came from advisory council involvement who were users and said, this is what we don't like about what you're doing. Can we do this instead? And, the greatest ideas come from people that are using the system. We also feel that there should be core AAA programs that we all operate so that there are consistencies between the counties that would really allow for the growth in the population and that are tied to some kind of increase annually, like the consumer price index. So for this, I mean, if you were, you would decide, AAAs must provide these 6 services. Great, we all do it, but there's something that's built in that every year we can serve more and more people as the population increases, but we also have the funding to do that. We also want to make sure that there is local flexibility and determination for those non-core programs. So what makes us great about AAAs is that we are so nimble and flexible. And so we need to be able to maintain some of that. Also, just recognize that developing a system that works is about relationships. It's about leadership and also funding as well. We are also recommending to streamline funding sources to improve system navigation and also make sure that, as the state is looking at overall what can be done, maybe it's time to review some of the regulations to ensure that barriers aren't present that negatively impact access to services. So those are my recommendations. And I think with Eli and I both can answer questions as well. Thank you.
Great. Well, I think we will turn to a comments and questions period. And I know I see a couple of folks who've already dropped their questions and comments into the Q&A. If not, this is a great time to do that. And certainly feel free to use that raise hand feature on your Zoom toolbar, and we can open your line to hear from you directly. Next slide, Nancy. Thank you. So there are a couple of questions here just to kind of kick off that conversation. So you'll see, how can the state help communities establish a hubs and spokes network for aging and disability in your community? What are the opportunities and challenges? And do you have advice or comments to share? And for those who are joining us by webinar today and you're on your computer, you may see a little pop-up. We have a poll going that asks, do you have a central access point? So go ahead and let us know and we'll share those results with you shortly. And with that, I think I will pass it off to maybe Carol. Carol, do you want to take a couple of questions from the Q&A?
This is Connie. I can start the first one. I think Carol's looking at the questions right now. But we had a question that came in via email earlier. And one of the questions is, it seems like the increased costs and administrative fees under the new example might result in less benefits being available to members of the aging public under the proposed system. Victoria, do you have any feedback or an answer for this one?
Sure, I would be happy to answer this one. So I guess my answer would be that it doesn't necessarily, result, movement under the county structure, I guess, doesn't really necessarily result in, increased costs. It can, but I would also, I guess I'm curious as to the question, because I haven't seen anything posted on the Hubs and Spokes site that, shows that there are, increased administrative fees. So I guess I'm unsure as to what the full question is. But, in my experience, yes, I have increased costs for some programs. But we also look for outside funding as well. So it's not a given that the county is necessarily going to always come up with the additional money that I need. My CEO's philosophy is, you want the program and extra funding, then go find the money.
Great.
Hi, Connie, I can take the next question. What is the role of local senior centers? I think that could go to Victoria or Eli.
Sure. So our senior centers are, they're a pivotal part of our whole system. They're the congregate meal sites. Many times they're the home delivered meal program operator as well. They house classes for, fall prevention. I think that they have to be part of, the system. And AAA, and it has to be working with them, and probably the ADRC as well, the disability partners, because you don't just serve younger people with disabilities, Eli, right? It's people with disabilities of all ages, including seniors. So you would be referring.
Yeah, I would just double down on that. And as Victoria said, it really is recognizing the, full spectrum of older adults and people with disabilities, and older adults who are acquiring disabilities that might need peer support, peer role modeling. And senior centers, social isolation has just been such a significant issue and barrier, particularly during COVID, for our older adult and disabled community members. And there are examples, and again, in Marin, we have an awesome example of, through our hub and spoke and through, again, Vivalon, we've created a student, connection with, older adults who might need just to be checked in on, a wellness check. And I think though that, going back to the role that senior centers and community centers supporting folks of all ages can play, it's going to be essential to engage them, particularly during these times when we're all sheltering in place.
Fantastic. And I thought maybe we can pause here and share the results of that poll that folks saw earlier. The question was, do you have a central access point? And it looks like about 58% of the folks who responded said yes. Another 18% said no. 3% said no, we don't have the resources to create central access. 7% said no, but we're interested in creating central access point. And then 13% said, I don't know. So it feels like a lot of folks do have a central access point. There's interest in creating a central access point, and a subset either don't have one, don't feel like they have the resources, or are unsure. So thank you all so much for responding to that. And I know that we've got questions pouring into the Q&A, but I do want to recognize that Deanne Rosenberry has her hand up. And so Deanne, I'm going to open your line. You'll still have to unmute yourself, but we'd love to hear from you. Go ahead.
Hi, can you hear me?
Mm-hmm.
Okay, great. So just back to the question, I think the very first question was about the funding and the cost. And so I was reading the LA County Board of Supervisors with the LA County AAA and the LA City. They were talking about combining their two AAA structures into one under the County Department of Aging Services. They were going to develop the Economic Workforce Development Department and the Aging Department. And so in a letter from the County of the Los Angeles Chief Executive Officer to the LA County Board of Supervisors, they're estimating that the cost is going to be $13.9 million annually for the creation of those two departments. And then there's a one-time only cost for reconfiguration of space. So I wonder if that's part of what maybe that first question was about, as far as what might this cost annually to each AAA that is maybe currently not under the umbrella of the county. So maybe that can help. And maybe we just maybe direct that back to you then, Victoria, or someone else, Thank you for letting me speak.
Absolutely, thank you. And Victoria, do you have a sense?
I think that just having read the Los Angeles documents, which are on CDA's Hub and Spoke website that she's referring to, it's my understanding that some of the cost is that, one is that they are separating a department from, 3 departments that are part of one, creating a standalone, and then the merge. And when you have, existing staff that are spread apart in multiple funding streams, when you have a standalone department, you have to have those functions, in each of those departments. And so that is, the creation of, jobs to support that department, where before the cost was shared by multiple, funding streams. I can't speak for, other counties as far as what the cost could potentially be if they were to go from, a non, profit, say, to a county structure. But there could be an increase in cost if the county determines that additional, staffing is required.
If this is Kim if I could just add some state perspective on this. I think we all know that delivering service costs money. And we all know that we need to deliver more services. So there are going to be costs that come with serving a growing and diversifying population. And the point is that we provide outcomes and we have accountability for that. And so regardless of whether your AAA is 1 county, 2 county, 8 county, whether you are county-led, nonprofit-led, or JPA, you need resources, and you can expect, and you should have support from the state, and you can expect to have increased accountability for the outcomes. And so there will no doubt be ongoing conversation of what that right size of resources is, as there are with any service delivery system. And we should have that robustly. That is absolutely part of fulfilling the promise of the master plan. But I think there's a lot of variables that go into making sure that you ultimately, at the end of the day, have the outcomes. And we're open to all of the input and feedback and discussion on that.
Great. I don't know, Eli, if you have a perspective you want to share, and I certainly see both Connie and Carol have some additional questions they'd like to pose to you both. So
I would only say that there's also what happens if we miss this opportunity and we don't meet the needs of our community. There's a cost associated with everything, but it's also about the risk that we put our community members with disabilities, older adults, to when they're not given coordinated service and advocacy. And I think that's really, centering this on the community members that are coming into our organizations or calling us, asking for support. How do we make access, how do we support them as best and build an infrastructure, build a home so that they can access all of the spokes on the wheel to maintain their independence, particularly during these challenging times. And I think just bottom line, you have to invest in building that structure. But ultimately, you're saving in the long run by supporting community members as opposed to putting them at risk.
thanks, Eli. That's a very good point. It looks like the next question, Connie, you've kind of flagged for posing. So I'm going to add a spotlight and then maybe we can turn it over to you.
We've got a question here. It says, I would love to hear from Eli and Victoria what evaluation tools they use to review their organizations. They are both amazing leaders and run great programs, and I'm interested to hear how they ensure the community is able to give feedback about their services they provide or services that the community would like to see provided.
Do you want to start, Eli?
Sure. We are refining our data tools. We've had traditional tracking systems that we've used for years as an independent living center. We're also looking into new data systems. We've developed an encrypted email exchange with the county to share data back and forth. In terms of tracking our core services, as well as our health outcomes, We are evolving on that. We've added a pre and post wellness tracker that measures social determinants of health coming into services and then going out of services. But honestly, I would say that our data is evolving. We want to ensure that we're not only measuring what's mandated and required as a service provider, but we're also demonstrating positive health outcomes for the community members that are accessing our one-door services.
Yeah, and from our perspective, we do a lot of customer satisfaction surveys, and in our call center for our ADRC, one of the they do post-call surveys. We are required to report quarterly to the CEO's office satisfaction results for our programs. And the county uses a standard, measurement so that you can actually see, across all agencies and really departments where we're at. But also, I think I have a tremendous team behind me that makes what I do look easy. And they're constantly coming up with, new things to measure, to look at how we can be, more responsive. How are consumers really getting what they need? And the other feedback loop that we also use is our advisory council. They'll be the first to tell me that we've missed the mark on something and that we can do better and improve.
And this is Kim, and I'll just say, a core part of the hubs and spoke concept is that we link all these hubs. We link Victoria to Eli, to Annie, so that we have some common measures and some common dashboards and some common computers to make that easy, so that we can all be held accountable for how we're doing. And I see a question in the chat, so that if you move from Ventura to Marin, we know you still, and you're not starting over. Or if your mom is in San Francisco and you are in Santa Cruz, your mom can call as a family caregiver with appropriate permission. So what we're trying to do is create that backbone behind this local leadership and local innovation to provide a little more commonality and network connection between us all.
Great, fantastic. And I just want to do one more ask. If anybody has a question, they want to have their line open, just hit that raise hand icon and we'll go ahead and open your line. But in the meantime, there are about 15 or so open questions in the Q&A. So Carol or Connie, I will kind of let you pick the next one. I know there's quite a few.
Sure, I'll go. One issue with seniors is remembering where and when and how to do things. Are there any plans in hubs and spokes to extend mere referrals to services to a case management format that can follow up to see if they actually received the needed services? I would pose that to Victoria and Eli to see if they have any case management services in their network.
Yeah, so I think one is that the ADRC, one of the core services, it's enhanced information and referral. So it's not just a simple pass off, here's the phone number to wherever you wanted to go. But, you also have, your options counseling, and you also have your short-term service coordination as well as a core service. So it's not just simply a referral system. Many of us also that have ADRCs also provide, as agencies, some type of long-term case management as well. And so we are, as somebody that's calling in, we are following up with them later as an ADRC or as a case management program. Did you get what you needed to do? What you needed, what you called for. And if you didn't, how else can we help you? And that is something that as AAAs, as part of our, not even an ADRC, but it's AAA, information and referral service, we are required to do that as well.
I agree with Victoria, and just add that we also partner within our one-door ADRC with other case management providers, Marin Community Mental Health, Veteran Services, Adult Protective Services, there are so many levels of case management, right? There's the ADRC model, which is short term. As Victoria mentioned, many of us are also doing longer term, but then there's kind of specific behavioral interventions, working with the IDD and dual diagnosed community. And I think, all of those levels of case management should be looked at when building out a coordinated model.
Great, fantastic. I saw a question in here that was really for Eli. It feels like a really straightforward question, so I'll just ask it. How many people are served under the ADRC model in Marin?
That's a great question. And if I had my data person on the call, I could answer that. I also have a great team behind me. And I'm not the data guru. But I know that we're doing great work. On average, Marin CIL alone serves about 1,500 unique clients each year. I know the county serves that many more fold. And we are, again, being honest and candid, trying to figure out how to measure the impact of both all of the IL services we're providing, as well as county services, and then that intersection under the ADRC. So I don't have a direct answer for you right now, but it is definitely a refining process. And I just say again, kind of looking at those impact measurements on what we've done with COVID, if you look at the broadest level of service coordination, it's certainly in the thousands.
Thank you, Eli. And Victoria, I don't know if you have a sense from your perspective. There's also a question about staffing, which I will kind of look at you and see if you want to take that one on as well.
So sure. So I think last fiscal year, I want to say we served these are the core partners. So it's us as a AAA and our independent living center. I think collectively we had 55,000 customers calls that came in.
Yeah, that's quite a bit. And then kind of swinging back around to this staffing question about how much staff do you both have to kind of support that? And maybe we can start with Victoria and then jump back to you, Eli.
Great question. I'm doing the mental math. So one is that once you become a designated ADRC, there is state funding to support your operations. So on our phone lines, we have, I think, 6 full-time individuals. We have a call center manager as well. I want to say agency-wide, because remember the ADRC is not just your call center. Really, it's the whole ecosystem of what we provide as an agency as well. And so I want to say we have about 65 people on staff that also provide various supportive services for the ADRC.
And Victoria, I'm thinking maybe it's something we can work on with the C4A. We are, after every town hall, we have more requests for information about the AAA network. And so we have some information about the number of staff in each AAA. And of course, it's a little bit apples to oranges, but we think we could work with you all to provide some visibility on that so people can see. We know we have the funding posted. We just got a request to post the local match. Now this request for staffing, so we can work with you on what the most useful and transparent way to do that is.
Yeah, and for us, we've hired 4 new positions. Marin CIL is the fiscal entity for the ADRC funds. So 4 new positions specific to the ADRC. But then, like Victoria, we have many staff in both of our organizations coordinating, involved in ADRC service delivery. So that number is close to 60.
Fantastic. Thank you, Eli. Maybe I can turn it over to Carol to pick the next one, and then maybe Connie can take over for a bit.
Sure. This is a good follow-on question, and it's directed at Ventura, but I would direct it at both Eli and Victoria. It's what has made the Advisory Council an important part of developing programs and services, and how does the Advisory Council participate in developing programs?
Sure, great question. I love my advisory council. So they have standing committees and we really talk about like the issues. So we have housing committee, a transportation committee. They were involved with a subcommittee developing our whole ADRC. We used to have a legislative committee. We have a nutrition and health committee, optimal aging. And so we really look at them because they're in the community, they're older adults. I don't qualify for the services that I administer. And so I cannot tell you what the experience of being an older adult and what the needs are because I don't have that lived experience yet. And so we are constantly seeking their feedback, what they want to work on, what they see as local problems in their communities. And I just have to give like 2 examples of like, well, actually, 3 examples of where it's really worked. One is that our incredibly responsive senior nutrition program is a direct result of, advisory council involvements. Years ago, the county, another agency ran it. The county decided that they weren't going to provide the net county cost for it. It was too expensive. They told me I had 9 months to find a new home for it. And so the advisory council jumped in. We got every city to agree to, to actually, provide support for it and to run, the senior nutrition program. And where cities couldn't, we had great nonprofit, other governmental partners that stood up. That's one example. 2, transportation. It's an issue. They said, why aren't we doing like door-to-door transportation, like door through door? The curb to curb does not work. We said, okay, we'll look at it. Now we get like $500,000 a year in transportation funding to actually run a door through door, service. Another one is housing. We have to do something about housing. Where are all these people going to live? We have an increased senior homelessness. And one of the things that they asked us is, can we have a shared housing program? So we said, why not? We investigated and now the county helps provide funding for a home share program. I think, every community has older adults who are activists who have great ideas. It's just, you have to listen.
And just to
find the resources.
I want to thank the Commission on Aging, which of course convenes the statewide TAC quarterly and is meeting tomorrow and has hubs and spokes on the agenda. So we can hear from the statewide TAC and actually want to explore what you're saying, Victoria, what could be an ongoing feedback mechanism tied to this project with the statewide TAC. So welcome ideas on that as well. Thank you to the Commission.
Well, I'll go with another question. So how much and how often do both of you communicate with your other ADRC core partners? So for example, Eli with his AAA and Victoria with her ILC.
I talk to my buddy Lee almost every week, sometimes multiple times a week. So I think communication is absolutely key. Our leadership, Lee and I talk weekly. Our staff have case conferencing on a weekly basis as well. And then, one level above them, the management team is also coordinating weekly. We have a formal kind of all hands, ADRC leadership meeting with our entire team on a monthly basis. And, we use all of those different levels of meeting and communication to kind of triage, navigate, and calibrate, our services, or if something isn't working or needs to be refined, addressing those issues in all of those meetings. And I just want to stress, particularly if you're just starting up a ADRC or a hub and spoke model, building that trust, building that communication, recognizing that, we do have unique cultures within, AAAs, CBOs, like independent living centers, other providers. And, we have so much to share and teach each other, as leaders, as advocates, hearing from our community. And so having those regular check-ins is really essential to building a better service model.
Yeah, I would agree. And I think that the communication happens on multiple levels. So understand that it's not just, me picking up the phone and talking with Jennifer Griffin, who is the executive director of our independent living center. Can I, anytime? Yes. So we are available to each other, but it's more important, I think, once you're up and running, is that the staff who actually answer the phone have to have that relationship between both agencies. And so there is a lot of communication. We do co-trainings. There's monthly meetings between those staff. My deputy director is in frequent communication with the staff person that's over the ADRC at our independent living center.
Thanks. And I do see that we've got a hand raised from Ronald Lee. So Ronald, I'll open your line. You'll still have to unmute, but we'd love to hear from you.
It's actually Diana Jimenez. I couldn't get the link, so Ron shared with me the link. I'm from Monterey County, and so my first thoughts, about this new framework, it reminds me a lot of the CalWorks 2.0 model that was implemented for CalWorks families and creating a holistic approach in serving the needs of families, right? That went above and beyond just safety net services like CalFresh, CalWorks, and Medical, but expanded it to what are the housing needs? What are the counseling needs? What are all the support needs for these families to help them be successful? And then a second piece, break the cycle of poverty, right? The second generation poverty issue. So it kind of reminds me that this is in my brain, because I come from the CWES world, and CB world and WIOA world, that this reminds me of that, is really looking at a holistic way to serve the needs of our elders in our community and individuals with disabilities, so that they don't have to tell their story 1,000 times to all these different agencies that, I'm relatively new to the aging and adult world, but I'm still over CWES, but just learning, even myself, trying to navigate even the acronyms, like what the heck does all these acronyms mean? And then we're a AAA within a Department of Social Services. So our AAA is county run, and we are an emerging ADRC at the same time. And to be honest, I was really stressed about all of this change because I'm just trying to get the basics now. But what stressed me out is there were so much different terms being used. And then I was afraid okay, we're going to have to reinvent the wheel and create a whole new different system, but it's really not about that. It really is about enhancing what we do. And again, creating this holistic approach to meeting the needs of our elders and individuals with disabilities, similar to CalWorks 2.0, and really building on what we have to create better, as I think, I don't know, is that your word, Kim, something about building better or something like that, but so that kind of helped ease some of my stress. But as a county-run AAA and now ADRC, one of the challenges I find is that there isn't the funding money. It's really awesome that we're getting all kinds of new monies, but that takes staff. I only have one AAA official paid staff member. And so I'm having to pull on all kinds of different staff to take on more roles and responsibilities that are not paid for at all through any of this funding through the AAA, because we passed the bulk of that money through to our partner agencies for services, yet my staff and I were having to do all the state reporting, which is massive. And I love the idea or where you're going, Kim, on streamlining the reporting and streamlining the contract. So just when we think we're done with a contract, there's an amendment, and then there's new money, then we have to start all over, and it's very time consuming. And really, when we barely have enough to pay for one staff, I'm having to pull all kinds of analysts from their jobs to help with this. And there is not sufficient administrative funds to run these programs effectively. So I just feel like we've been putting out fires. And what I would love to do is really build the aging and adult services model like the CalWorks 2.0, because we've been very successful in CWES to build the holistic approach. Our numbers are really high. Our families' needs are being we added some mental health, legal services for families, just housing, all kinds of things. I would like to do that here, but I really don't have the administrative support to do that. And then add to that, we're still learning, add to that, all the complex reporting. And just like when we thought we got it, we didn't. And then some state rep is calling us about something we didn't do or need to do. So that's very complex, honestly, all joking aside. And so just wanted to share my thoughts on that.
Thank you.
If I can, that's an extraordinarily helpful analogy for those of you who are familiar with the CalWorks 2.0. Sometimes we call this AAA 2.0, CDA 2.0. Sometimes we also talk about accountability and outcome. So just 3 points, you made many, but 3 that have resonated, I want to just call out. So 1, you're absolutely right. When CalWorks moved to that system with new outcomes and accountability and Common Core, it did come with new administrative resources. And so I think you're not wrong to raise that question, that if we're talking about more care coordination, more accountability, more outcomes, that takes people and that takes systems and that takes resources. So resources is absolutely a welcome part of the question. Second, I think the one thing that we're trying to do here really also is called the foundation question. There's a reason we're saying both the frame and the foundation. And I think, Eli, you're working on your foundation at your home right now. So I have to kind of laugh. But I think we want, if you're going to build this framework, your foundation has to be strong. And so we do want to invite people to look at your AAA, CBO, and county relationship. Everyone's got a different one. And so LA County really and LA City are leading the way. They're in looking at theirs, and we are working to support their effort. And we invite everyone to do that. Is your foundation where you need it to be so that you can build that framework on top of it in the way that works with your community? So that's part of why it's called this hubs and spokes, is it's got both that foundation element and the framework element. And the third thing I want to say, because it's my I gotta say it, the acronyms in this field and the ADRC, ILC, AAA is confusing to us. It's confusing to the people we serve. And so it is absolutely a public facing part of this. Maria Shriver and so many others called for this, that we come up with a public brand. Marin has got the one door. Other people have used, young children have first 5. Minnesota calls it linkages with age capitalized. But a tagline that anyone in the whole state knows, that's where you go for help. And they have a website that helps them, a phone number that helps them, and then goes to you all, right? Goes to the local experts, the local partners. But one identity so that people can find us more easily, no matter where they are geographically or age or ability, in multiple languages, fully accessible, of course. So that is one part we haven't talked much about at the Hub and Spoke Network, is having a really clean, easy way to find folks, even as we then branch down to the people who are right there to meet their needs, but make that easier to find. So much you lifted up. Thank you for your experience and your analogies. There's things we can learn. Aging is unique, disability is unique. Thank you for raising that, Eli, but there are some lessons to learn from other similar efforts.
Great. Connie, do you want to take the next one?
I think we can probably do a couple more questions. It looks like we have about 10 minutes left. So this one's actually a good one. And I guess it'd be Kim, Victoria, or Eli to answer this, but in this model, is the hub the AAA or the ADRC? So I think a little bit more clarification on, what exactly, how the model works and fits.
We're both the hubs. It's like one hub, yeah, we're partners in the middle of the hub. And in different counties, communities, the AAA might be the fiscal entity or the independent living center. But the key is, we come to the table as peers, as equal decision makers, collectively building out what are ADRC and how the core services get delivered. So I would say the hub is both partners, and then the spokes are all of the extended service providers within the networks we're working with, and those core services that connect, the ADRC core services that connect to all of those partners as well.
And I don't want to speak for Annie Chung. I would never deign to do that. But I also picked up Annie talking about how in San Francisco, The local senior centers are neighborhood hubs. So there is a hub in Chinatown, there's a hub in the Mission, there is a hub in the Castro, and those are kind of physical hubs as well that provide that same hub and spoke service. So you're right, the word is being used in a couple different ways to try to capture the spirit of a place where you can start and get everything, but also everybody has a role to play across the community.
Great.
Here's an interesting question. Is there any dream of expanding this concept to government services in general, local up to federal?
Well, since you asked, I think this is many of us are reflecting on the experience of the pandemic in many ways. And there are many lessons to be learned, but there's no question that the partnership between the power of government and the reach of our nonprofits has been essential to whatever success we've had at vaccination efforts or PPE efforts or other essential life-saving efforts. And so that is absolutely a dream of mine, that we in Aging and Disability can model that for the rest of government and nonprofit, that we don't need to be rivals of each other, and we don't have the time to fight with each other. We both bring unique and essential assets to the table that people need us to do. So it's a very, very insightful question, but that is absolutely my dream, that we are creating a new model of and maybe it's not new, we are reinvigorating and strengthening. And again, with equity and the consumers at the center, if you have community groups and community members at the center as peers, as Eli said, at the table, as Victoria said, it changes how government delivers that power and those resources and that backbone. And so, yes, that is my big dream, is that we are doing, and already you're seeing it, something different that can build out of the pandemic and truly build back better.
Fantastic. And I see we have a hand raised. Joe Flynn. Joe, your line's been open, but you'll need to unmute. Oh, hand down. Okay, so maybe it was hit by accident. There's a question here about villages, and I actually think it came up a couple of different times, but are hubs and spokes going to include villages? And just for some background, folks who aren't as familiar, villages provide the infrastructure for social care, the services and supports that address social determinants of health for older adults throughout the state. There are 50 villages in California and 350 nationwide. So I'm wondering if Kim, Eli, Victoria, if you have any thoughts about that.
The Villages Network is very strong in Marin, and they play a leading role in part of our advocacy and service coordination coalition. I mentioned the Aging Action Initiative and the Aging and Disability Action Initiative, as I like to call it. So they're very much involved as kind of an extended partner in that context. And, you know, while they're not kind of a contracted partner as of today, I think that's certainly something to think about for future planning, because they play a important and emerging role in information sharing and peer networking, again, you know, peer-to-peer mentoring and peer-to-peer support for all of our communities.
And for us too, we have a strong relationship with our One Village organization in our county. And they share information that we share with the community, and they connect their members to our services as well. So it's a great reciprocal relationship.
It looks like we're coming. Yeah, looks like we're coming close to time. So before I toss it over to Commissioner Marcy and Commissioner Annie, I just wanted to wrap really quick. Nancy, can we go back to, I think it might have been slide 3. Well, okay, yeah. Sorry, website slide. It's fine. I guess go down. There we go. Just wanted to bring to your attention again where you can find all of the hubs and spokes information. So there's resource links there. There's also links to the previous town hall and also the kickoff. Also, you'll find the link to our survey. And we also have a webinar that will take place tomorrow. Dr. Kate Wilbur will be speaking about tracking progress with the AAAs. So we'll also throw that link in the chat as well. I believe Nelson can throw that in the chat. So with that, I'd like to toss it back to Commissioner Marcy and Commissioner Annie, if you guys have some closing words for us.
Well, thank you very much for everyone, like your input and your comments and your questions will be very, very helpful to all of us on the commission as well as on the staff level. I have to say that having, like a witness that how sometimes when we put the seniors in the center of our universe, and that's the starting point. And the hub and spokes and the ADRCs is exactly that, senior centered. And I think that it probably will always lead to good outcomes. So thank you very much, everyone. Marcy, are you?
Hello?
Marcy, yes.
Yes, I just want to say, well, this has been wonderful. Great questions. Was a great listening session. You raised a lot of issues. There's a lot of material here we can take away and think about, and we'll be coming back. The department will come back. I think it's December, and look forward to all the possibilities that can happen with all these new opportunities. And I want to thank each and every one of you for coming today and taking part and engaging in this session.